What is type 1 diabetes? Diabetes is a metabolic disorder that causes blood sugar levels to be higher than normal and causes many symptoms. The disease is divided into two types as type 1 diabetes and type 2 diabetes. Type 1 diabetes is also known as insulin-dependent diabetes. This is a chronic condition that occurs when the pancreas produces little or no insulin, a very important hormone that allows glucose, sugar, to enter and create energy for cells. Without insulin, too much glucose builds up in the blood leading to diabetes. Over time, high blood sugar can cause serious problems in your heart, eyes, kidneys, nerves, gums, and teeth. Common symptoms. Symptoms of type 1 diabetes. Type 1 diabetes. Symptoms of type 1 diabetes can come on very quickly and include blurred eyes, frequent urination, feeling very thirsty and hungry often, frequent infections, feeling tired and weak, wounds take a long time to heal, numbness in hands or feet, rapid weight loss for no apparent reason. You may experience other symptoms and signs not mentioned. If you have any questions about symptoms, consult your doctor. When do you need to see a doctor? If you have the symptoms mentioned above or have any questions or concerns, consult your doctor. The location and medical condition can be different in many people. Always discuss with your doctor to determine the best method of diagnosis, treatment, and management for you. The cause to the illness. Causes of type 1 diabetes. This condition occurs because the pancreas does not produce enough insulin. As a result, glucose cannot get into your cells to help you store energy and leads to high blood glucose levels causing hyperglycemia. For most people with diabetes, the cause of insulin deficiency is usually the immune system destroying the beta cells in the pancreas. The reason for this phenomenon is still unclear. Other causes include other conditions such as cystic fibrosis affecting the pancreas, surgical removal of the pancreas, and severe inflammation, swelling, irritation, of the pancreas that can also cause this condition by damaging the pancreas. Pancreas. Risk of getting. Who is at risk for type 1 diabetes? Nutrition advice for people with diabetes. In general, type 1 diabetes is much less common than type 2. Men are more likely to develop type 1 diabetes than women, especially those with pancreatic problems or a family history of the disease. The disease usually begins between the ages of 4 to 7 years and 10 to 14 years. Factors that increase the risk of type 1 diabetes. The clear risks of type 1 diabetes have not been identified at this time. Factors that are likely to increase the risk of this disease are family history. Anyone with a sibling or parent with diabetes is at increased risk. Genetics. Certain genes can increase the risk of the disease. Age. Although type 1 diabetes can appear at any age, it usually appears at two most noticeable points. The first time appears in children 4 to 7 years old and the second time in children 10 to 14 years old. Some other risk factors may include exposure to certain viruses, such as Epstein-Barr virus, Coxsackie virus, rubella virus, and cytomegalovirus can cause autoimmune destruction of islet cells, or viruses that infect these cells directly. Drink cow's milk soon. Low levels of vitamin D. Drink water that is high in nitrates. Introduce your baby to cereals and gluten early, before 4 months, or late, after 7 months. Having a mother with preeclampsia during pregnancy. Congenital jaundice. Effective treatment. The information provided is not a substitute for medical professional advice. Always consult your doctor. Diagnosing type 1 diabetes. Diagnosing type 1 diabetes. Your doctor can diagnose type 1 diabetes through the following blood tests. Fasting blood sugar test. Test glucose tolerance oral. Hemoglobin A1C. Test. Random blood test, without fasting. If you're diagnosed, you'll likely need to see your doctor every 3 months to Check your blood pressure. Check the skin and bones in your legs. Check if your legs have become numb. Examining the back of the eye with a special light tool. HbA1c test every 6 months if your disease is well controlled. These tests will help you and your doctor control the progression of type 1 diabetes and prevent possible complications. In addition, you should also perform the following checks annually. Have your cholesterol and triglyceride levels tested every year. Visit your dentist every 6 months to prevent dental complications. Get tests done to make sure your kidneys are still working properly, like tests for microalbuminuria and creatinine ratio. Treatment of type 1 diabetes. In this form of the disease can get worse very quickly, so the person diagnosed with the disease may need to be treated in the hospital. You may need to check your blood sugar every week until it's completely under control. Common treatments for type 1 diabetes include 1. Insulin. There is currently no cure for type 1 diabetes. Therefore, insulin injections are the best way to quickly control a patient's blood sugar. Patients can self-inject insulin at home as directed by their doctor, usually 2 to 3 times per day. 2. Special diet. A special diet will help control blood sugar levels. Dietitians can assist in managing this diet. 3. Exercise. You should exercise more often because exercise can help control blood sugar. In addition, you also need to take care of your feet and have your eyes checked regularly to prevent future complications. Suitable mode of living. Stay healthy with type 1 diabetes. Blood sugar. You can manage your condition well if you note a few things below. Follow a special diet and snack at the same time every day. Exercise and get enough sleep. Measure your blood sugar regularly at home. Call your doctor if your blood sugar gets too high. Call your doctor if you have a fever, nausea, vomiting, or are unable to hold back solids and fluids. Get to the hospital right away if you have a seizure, are unable to stand up, or are unconscious. Strictly follow your doctor's instructions about taking insulin.